Okay.
So for suctioning trach and trach care, you would begin by gathering all of your equipment, perform hand hygiene, enter the patient's room, identify the patient, ID and wristband. Yes, you confirm that. I would auscultate the patient, assess for any pain medications needed, and then I would let the patient know that if and any time they are in distress, I will have them raise their hand. I would begin by attaching the suction to 150 millimeters of mercury, have that accessible to me. Attach the oxygen, adjust that to 10 to 15 liters, have that accessible. I would place the pad over the patient, and then I would open my package away from me, pull out my box, place that here, grab my saline, lip it, if it's already open, which it is, pour that into here, and then I would remove these gloves, perform hand hygiene, open up my sterile gloves, and put those on. Once I have those on, I will grab my suction, coiling that in my hand, and then I'm going to go ahead and wrap it around my hand. Then I will attach it to the suction, making sure not to touch this tube. Then I would go ahead and place this in the solution, coil it back up into my hand, remove the oxygen, perform 3 breaths, and then begin to put the suction in for no more than 10 to 15 seconds, rotating and occluding to suction it out. Then I would wrap it back around my hand, give 3 more breaths, 3 to 6. Rinse it, and then go ahead and go back in, occluding, which I broke sterility there. Not occluding this, and then suctioning for no more than 10 to 15 seconds, taking that back out, coiling it back up, 3 to 6 more breaths, and then I would clean one more time, and then suction inside the mouth. Once I'm done with that, I'll coil this back up into my hand and remove the suction. And remove the trach tube, as well as the old bandage. Wrap this up in this hand, inside my sterile gloves, removing those and disposing properly. Once I'm done with that, I'll perform hand hygiene. Provide oxygen again. Put on clean gloves. And then I will open my trach kit away from me and drop this in an unopened package, get a new box, pour about 1/2 inch of saline in there, and then I would remove my sterile gloves out of there, get rid of these gloves, open up my sterile gloves, these ones are tiny. I haven't broke it yet. Look at that. And then I would organize my tray here a little bit. I don't need that. So then I would start with removing the oxygen again and holding this in place and curving downward, placing in the new trach until it clicks. Once it's in there, I will clean around it, all 4 sides, trying not to break sterility here. Disposing of that, grabbing a new one, cleaning underneath. And then on top. And then the other side. And once that's all clean, I will go ahead and dry around it. Get rid of that. And then grab my split one and try to place it underneath here, underneath the old band. Once I've done that, I would open my new package here and then remove my sterile gloves, put on clean gloves after performing hand hygiene. Grabbing my new band, taking off one side, placing the new band underneath. Once I put this one through, I will make sure that I can fit one finger underneath the band to make sure it's not too tight. We can release the suction now and then reapply oxygen. Then I would clean up some of this stuff, auscultate again, checking breath sounds, checking the O2. Then I would get the patient back to a more comfortable position, make sure they're okay after this procedure, understand everything, and then clean up all my equipment and remove my gloves, my goggles as well, which I should have put on earlier, my goggles or, or a shield, and then I will perform hand hygiene.